Hey, this is John with the LBL Group, coming at you with another Mental Health Monday. A reminder, we're talking about mental health because we know it's an important area of overall health. It's both a cause and a symptom of a lot of the woes in our healthcare system today. And with poor mental health, overall healthcare declines, right? So it's an overthought, or sometimes this is not even addressed. And when that happens, healthcare outcomes get worse, quality of life goes down, and spending on other kinds of medical costs goes up. So the actress Taraji P Henson from Empire and Hidden Figures, she's been pretty vocal about her own father's struggles with mental health. And so in response to that, she started a foundation, the Boris L Henson Foundation. It's striving to improve mental health in black communities, and is what it does is it covers the first 5 counseling sessions for people in need of mental health treatment. There's some pretty eye-popping statistics for the foundation. So far it's covered more than 3,000 counseling sessions for more than 600 applicants, which is pretty cool because that means most of the applicants are going through those full 5 counseling sessions that are offered. Additionally, 45% of people receiving counseling through the foundation, it's the first time they've engaged with mental health treatment before in their lives. And then finally, 95% of the applicants are African American, which is huge because we know there's a lot of undertreatment and underdiagnosis of mental health conditions and mental health overall wellness in the black community. We know, looking at the statistics, that black Americans are less likely to get diagnosed and treated for mental health conditions, even though they report higher instances of the symptoms of emotional distress. And despite their needs, only 1 in 3 African Americans with mental health needs actually receive care. We know that they're less likely to receive guideline consistent care, they're less included in research, and then they're more likely to use emergency rooms or primary care access as their mental health treatment rather than actually using mental health specialists. There's barriers to getting access and getting the help people need. One of the most common ones is what's present across the entire country and the world, which is stigma, where people view mental health illnesses as some kind of personal weakness. Then on top of that, there's socioeconomic disparities, things like having a much higher percentage of uninsured population, which for the black community reaches 11.5%. And then finally, there's provider bias. We mentioned less being represented in research, and that shows up as well in providers, right? And we've talked about this before, right? Women reflect pain differently than men do. And for African Americans, they might have different symptoms or things going on when they're experiencing emotional distress that if providers aren't aware of how to diagnose and then to treat that, it's just not going to be addressed. And so, like in so many other areas of healthcare, a really key thing is going to be communication between a patient and their provider. And so something that you'll hear in the research is culturally competent care. Basically, is there a good open line of communication between that mental health specialist and their patient? Because if that can improve, you can have better outcomes for mental health treatment within a population. But additionally, because of all the other things we've talked about, you're going to also just have better quality of life overall. So check out the Boris L Henson Foundation, check out AFSP, check out NAMI. If there's other organizations working in the mental health space, let me know. I want to do a deep dive on them. I want to talk about what they're doing, how they're coming at the problem of mental health. If you have any thoughts, comment below. Let me know. I'd love to hear what you think. This is John Hans with the LBL Group, signing off with another Mental Health Monday.